Okay, Assalamualaikum and a very good morning to everyone. So today we will have a lecture on ocular drug delivery system. In a simple word, is that we want to deliver drugs to the eye, especially to treat the ophthalmic disease. So basically, in this lecture, we will see what are the barriers faced by ocular drugs in order to be effective, and further down the lecture, we will explore the existing conventional formulations for ocular delivery and their advancement, followed by current nanotechnology-based formulation development. Also, recent developments with other ocular drug delivery technology employing in situ gels, implants, contact lens, and microneedles will also be discussed. Of course, it is really important for us to treat disease related to the eyes in an efficient manner. Why? Without eyes, we lost our vision, which is the ability to see, and the ability to see is too precious to be lost. The eye is a complex organ with a unique anatomy and physiology. So delivery of drugs to the targeted ocular tissue is restricted by various precorneal, dynamic, and static ocular barriers. So with all of these barriers, it is quite difficult to maintain the drug therapeutic level for a longer duration of time to the target tissue. Moving forward, we will explore in details on why are these happening and how we can overcome it. But first, it's really important for us to understand the anatomy of the eye, and basically the structure of the eye can be divided into two main parts, which is the anterior and posterior segment. Anterior segment of the eye occupies around one third, while the remaining portion is occupied by the posterior segments. So tissue such as cornea, conjunctiva, iris, and lens make up the anterior portion. Back of the eye at the posterior segment, for example, that we have is sclera, choroid, and also the optic nerve. The anterior and posterior segment of the eye can be affected by various vision-threatening diseases. Diseases that affect the anterior segment include glaucoma, cataract, and also the allergic conjunctivitis. While the age-related macular degeneration, abbreviated as AMD, and also the diabetic retinopathy are the most prevalent disease affecting the posterior segment of the eye. So generally, drug delivery to the posterior segment is much more difficult to achieve than the anterior segment. Generally, the topical instillation is the most widely preferred non-invasive route of drug administration to treat disease affecting the anterior segment of the eye. So the conventional dosage forms, such as eye drops, account for 90% of the marketed ophthalmic formulations. The reason, simple, is actually be attributed to the ease of administration and of course good patient compliance. But we know that the ocular bioavailability is very low with topical drop administration. So here, as you can see, the drug can be delivered to the posterior segment ocular tissue by different route of administration, such as intravitreal, periocular injections, and also from the systemic administration. But of course, this is not really recommended. And among these, the intravitreal is the most popular choice, but not really preferable. Of course, it is kind of scary to have your eyes injected with needle. So, it is poor patient tolerance and has also the tendency to cause hemorrhage. Thus, this situation necessitates the need of an improvised and effective ocular drug formulation to reach the targeted tissue at posterior segment.